Megan, what do we know about the man who died from coronavirus in the state?
Well, Ashley, we don't have a whole lot of information about him at this point. We know he was in his 60s and he did have other health issues. What they were, though, we don't know yet. We're hoping to get more information about this later this morning when Governor Larry Hogan holds his news conference at 10 o'clock. But what we can tell you is that the number of coronavirus cases here in Maryland is going up exponentially. We now have 85 cases throughout the state. More than half of those are in Montgomery and Prince George's County. We have about 30 cases in the Baltimore area. We learned that a worker at Northwest Hospital in Baltimore County did test positive for the virus. They're now at home under quarantine, and LifeBridge Health says that anyone who may have come into contact with that person has been notified. There's also a patient at Sinai Hospital who has the virus. We're told they are doing well and expected to be discharged soon. Now, Hogan has taken a number of steps to try to slow the spread of this virus, including shutting down schools and casinos, restaurants, and gyms. He's also prohibited gatherings of 50 or more people. He says these measures, yes, they are disruptive. Some might think they're a bit extreme, but he feels they're necessary.
The reason we're doing this social distancing, closing schools, shutting down bars and restaurants, kind of an unprecedented step that nobody ever could have possibly imagined. But it's about stopping that surge in the hospital so we don't have so many people getting sick at the exact same time, trying to suppress that because no hospital in America has enough ventilators to handle that if everybody gets sick at the same time.
And in an effort to try to suppress that surge of cases, Governor Hogan is also asking for an additional 6,000 hospital beds. Right now, there are about 8,000 hospital beds throughout the state that are for acute care. So there's big concerns that there are not going to be enough beds to treat the number of people who may come down with this virus. We're live in downtown Baltimore. Megan Knight, WMAR 2 News.